Thank you very much, Mark. And now we will turn to Lois Pace, who's the Executive Director of the Global Health Council.
Good morning, everyone. I want to thank you all for having me join this panel of esteemed speakers as well. You will find that a lot of the remarks that I prepared actually overlap quite a bit with what's been shared already, so I think it'll serve largely as a summary of those comments and maybe sprinkled in a few examples of initiatives and programs that our member organizations are carrying out in the field. And so I did prepare a number of slides, just a few slides, just to provide the framework for the discussion. They're not too text heavy, but just to walk us through, again, what has been shared already. I can appreciate the title of this topic. Thank you. I think this is for me. I can appreciate the title of this meeting with regards to the changing landscape of global health, and obviously it very much is changing, and we at the Council are preparing for that change by trying to develop a new narrative for global health with our membership. And so working with the global health community, we're focused on a few areas moving forward in terms of our own call to action in response to how things are evolving. I think first off, as we've been hearing, we need to get across the finish line with a lot of the issues that we've been working towards for a number of years. And the great news is that is in sight. So looking at an AIDS-free generation and the end of preventable maternal and child deaths by 2030, looking by 2050 at eliminating or controlling malaria and TB. So this is the good news here, and this is what we want to continue to keep our sights focused on in the global health community. And as has been mentioned already, we have the tools to do this. These aren't question marks for us, right? We have Acting on the Call, we have Gavi, who I know is presenting later. Obviously, we've talked about PEPFAR and PMI this morning. So there's no question that we are able to finish the fight if we remain focused on that. That said, there are new threats that also we have talked about. So before this role, I did work extensively in cancer at NCDs, and so I can very much appreciate the comments around non-communicable diseases, as well as the conversation around neglected tropical diseases. So when it comes to NTDs and NCDs, we need to really face the music with some of these issues. I think NTDs has definitely seen more progress, as Chris said, with the London Declaration and with the 10 by 2020 initiative. As he said, the private sector in particular has really made a lot of fantastic investments in this space. And you've seen, in a similar regard, a private sector response to non-communicable diseases really sort of move that along. But I think with NCDs in particular, we still have had our heads in the sand, right? So it's clear that this is a leading cause of death worldwide, and even in low and middle income countries, this is not just a global problem, but even when you drill it down to these communities in certain countries, you're seeing NCDs really be a problem, and communities, not just countries, be faced with this dual burden. And so I would really continue to challenge the global health community to address what has been called this more of a slow motion disaster. So in recent years, we've been, focused more on, the coming crisis, right? The crisis du jour, and not really looking at some of these things that might take a longer time to develop, but still have really severe ramifications. And so similar to a lot of the goals we have across some of the other priority areas, we have this goal to reduce premature mortality of NCDs by 25% by the year 2025. So again, it's great to have these frameworks and goals in place, and again, you have commitments across sectors, but I think the action is what's limited, and I'll get to that a little bit more in the next slide. I think finally, in terms of the third pillar of our messaging at the Global Health Council, we want to, in addition to talking about crossing the finish line, finishing the fight, and otherwise focusing on new threats, we want to avert the next crisis. We don't know what's coming next, and we've seen this, in the past couple of years. We all grew up, I think a lot of us at least, going to state fairs or amusement parks, and you're playing that game of whack-a-mole, right? So you got your mallet, and this puppet pops up, and you're trying to hit it. And this is getting old, obviously, for a lot of us, and I think we're all growing weary of fighting the next crisis. So I would join the chorus of health system strengthening doing, recognizing that it has been a challenge and it's not sexy. And I think, we've rightfully focused, we've had a very siloed approach when it's come to global health and development over the years because we've had these big, bold issues that we've had to face with very specific focused investments. But we definitely need to really think in terms of building or improving our systems in a way that allows them to respond to the crises. And I agree with Mark and his comments regarding even breaking things down into discrete building blocks, looking at supply chains, looking at workforce, looking at discrete areas that we can focus on. And we all know the language around the diagonal approach. So you can take a disease area, you can look at the health system and sort of build a platform in that regard that can then respond to yet another disease area. So this is not impossible, but it will take creativity and it will require a shift by those of us in the community that might feel uncomfortable, but that is absolutely essential given the coming issues that we're facing, like antimicrobial resistance in other areas. I would also, with regards to this conversation around health systems, just continue to sort of build the case for R&D. It's something that we still don't talk enough about in the global health community, but obviously this idea of creating new technologies and innovation, whether that be in diagnostics or vaccines or in other areas, is going to be essential and a fundamental part of strengthening the health system and healthcare delivery. So that's sort of our narrative, I think, for global health moving forward. Now, given the shifting landscape, what do we see as the solution? I think that, this talk of integration there's a reason why people are focused on integration. There's a reason why we came together to develop the Sustainable Development Goals. But let's be honest, the incentives are lacking for us to do that. And so, we hear from the field, and I say we because Global Health Council, again, is a membership organization. And so we have partners working around the world. And what you'll hear a lot from stakeholders in the field is this is what I'm faced with. I have a woman walk in the door and I want to address all of her needs. She's pregnant. We want to be sure she has a healthy pregnancy. We want to be sure we screen her for HIV or even cervical cancer. We want to sort of address the person and not the disease. But if you look at the left of this slide, I mean, this is how we break down our resources. Our resources, our funding models aren't designed for the person. They're designed for the issues that they're faced. And again, we appreciate that. But the reality is a person is more than, these individual conditions or illnesses. These people that we're trying to serve really need to have some sort of holistic model in order to best address their needs. And so that is very much the challenge that we face. Now, what I'd like to do is offer, a few examples where I think this is happening and where it's working. So for one example is this fusion of cancer and the PEPFAR model. We have been working, or we are aware of the work of Pink Ribbon Red Ribbon. I've worked with that group personally, and that's a great partnership that involved a number of private sector actors. It was launched by the Bush Institute and Susan G. Komen alongside State Department, PEPFAR, and UNAIDS, and now a number of other organizations, both NGO and industry, have come to the table to really try and leverage the PEPFAR platform to address women's cancers and in particular cervical cancers. And so that is, an example of, trying to integrate across priorities and leverage existing platforms and resources in a way that I think can be very helpful for other conditions, other integration opportunities. You can sort of insert an additional comorbidity here. And I know that there are some challenges with putting too much on the PEPFAR platform, but again, I think given there isn't an appetite for new programs and new funding, we have to continue to be creative in this space. And I think that fusion of PEPFAR and cancer control has been promising. I think also if you look at the nutrition community, something that nutrition does well is they try to insert their priority into not only the global health conversation and into the global health space, but also into agriculture, commerce, state. I mean, they're working across those agencies. And so, in particular, when you're looking at sectors and how you can align yourselves or work outside of the traditional global health community, I think our partners in nutrition really have modeled that quite well. And then finally, another example is with the WASH community. So with WASH and healthcare facilities, again, this seems very obvious, but it's not something that we've done well historically. And now to really be talking about and thinking about how we can improve the availability of clean water in the healthcare setting, just so, when you're looking at delivery, making sure that there's clean water instead of, as someone told me recently, mothers or pregnant women are being asked to come to the hospital with clean water for their deliveries, which is, I mean, that's not the way you do business. You already have to worry about having a child, let alone carrying your water to make sure that happens. So those are a few examples, again, from our community of how people have been able to come together and collaborate in a time of limited resources and given the need to leverage those limited resources. But again, our ongoing challenge will be, the incentives around that. I agree with Jimmy in that a lot of integration comes together in the form of technical assistance, especially in the absence of resources. So that's a good thing for now. But I do believe that what can continue to drive this is this linking of metrics. And if I can be honest, I think that the main challenge is it's really no one's job to have to worry about some other issue. And we have to find some way that across these various global health priorities, across these various sectors even, we're all looking at the same metric. And I know that's the point of the SDGs, right? But how we really put those in place at a local level and ensure some accountability, that everyone's sort of holding hands around the same issue, that's going to be really important. And I worry that that's still not happening, that we're able to coalesce around goals and then trust one another that by achieving this goal we will all benefit, that there's sort of this raise all boats idea behind it. There's not We talk about that at a global level. That's not fully understood, I think, at the national level, or fully appreciated at the local level in a way that it needs to be in order for us to make progress. So I'm happy to have that discussion or debate, but I do think that that's an outstanding issue when it comes to integration of programs. Now, you, I think, asked us all about how we pay for all of this and who foots the bill. There's going to be a full session, I know, after lunch on financing, so I didn't actually prepare too much around this. I will offer a few of the models that I think we're well aware of. Something that the Global Health Council has been working a lot with is the Global Financing Facility and ensuring civil society participation in the GFF. But again, this is at least an attempt to try and pool both international and domestic resources focused on a problem that sort of an overarching issue of maternal, newborn, and child deaths. So that's we can talk more about the GFF, but the idea of really thinking differently about how we finance health and how that comes together is promising for the community. I think we still have some questions about how that plays out in the countries where that's being piloted, but it's something to look to as a model moving forward. I think also when it comes to taxation or insurance, these have come to be bad words in the U.S. context, but tobacco taxes has served as a good example and continues to be put forth, I think, as an opportunity in terms of raising at least domestic health resources, which again are really going to become more important moving forward, and also insurance schemes, how we provide health care and sort of look at private funding, both individual and otherwise, in addition to public funding at the national level will be important. And this last bullet isn't a typo. I mean, it's sort of this. There's still kind of space for the next big new idea, and I know other people much smarter than me have been thinking and talking about this, but as Jimmy said, follow the money. The money is obviously key with all of this, and this absolutely needs to be figured out because the reality is we are in a new era, and we continue to be faced with a number of global health priorities. It seems as though the list just continues to grow. And so I think all of us here on this panel are keen to figure out how we tackle both the existing and emerging issues that we face. There's still a lot to do. I'm hopeful that we can do it, honestly. And as others have said, it's a matter of not just getting the work done, but working differently than we have in the past. And the reality is, something that came across, I think, in the preparation materials is this question around silos. It's not even a question. I mean, we evolve or perish. We can no longer work in the way that we have been working. We won't be successful. And so we can sort of twiddle our thumbs or scratch our heads and sort of, wonder how we figure this out or say that it's too hard, but it's not going to serve us in the same way that it has in the past. We no longer have the luxury of going it alone as a community. And so I think given the shifting landscape, it would behoove us to really not just think about where we are, but where we're going with global health in terms of planning the future in this space. So thanks again for having me. Thanks again for having all of us, and looking forward to the discussion.